Welcome to KP Medical Front official YouTube channel. I am the admin of KP Medical Front, Muazzam Saeed. In today's lecture, we will discuss various anatomical terms in relation to the upper limb and the lower limb. Anatomical terms used in relation to the lower limb. The anatomical terms used in relation to the upper limb and the lower limb are nearly the same. However, there are a few exceptions. This is a general overview of the lower limb. The right lower limb. The anterior aspect of the lower limb. This is the anterior aspect of the lower limb. It is in the front of the body. The one visible on the screen is the anterior aspect of the lower limb, the right lower limb. The posterior aspect of the lower limb. The posterior aspect of the lower limb is to the back side of the human body. Looking at the animation, it is clear that the front of the body is called the anterior aspect, and the back side of the body is the posterior aspect. The medial border of the lower limb. The median plane divides the body into the left and the right parts. The medial border of the lower limb is close to the median plane of the human body. The medial border of the lower limb lies close to the big toe of the lower limb. This one is the big toe of the lower limb. The lateral border of the lower limb. The lateral border of the lower limb lies along the little finger of the lower limb. This is the little finger of the lower limb. The lateral border of the lower limb. The medial border of the lower limb. The extensor aspect. The extensor aspect is the front of the lower limb. It is the extension part of the lower limb. The flexor aspect. The flexor aspect is to the back of the lower limb. Here, the flexion of the lower limb occurs. So, the extensor aspect and the flexor aspect. Subscribe KP Medical Front for more informational videos. Thank you.